I welcome you all for today's webinar on Pharmacognosy, Natural Factory for Modern Medicine. Today we have with us Dr. Raju Wadekar, Assistant Professor, SVKM Institute of Pharmacy, Dhule, as a resource person. I would also like to welcome faculty members of School of Pharmacy and the students for today's webinar. Now I request Dr. Rajesh Patil sir, HOD, School of Pharmacy, to present an overview of PCET and Pimpri Chinchwad University.
Hello.
Hello.
Good afternoon, sir.
Good afternoon, sir.
Good afternoon, sir.
Myself, Dr. Rajesh R. Patil, Head School of Pharmacy, PCU, welcomes for the today's seminar and welcome our beloved guest, Professor Dr. Raju Wadekar, sir, the Professor of Pharmacognosy.
Sir,
The PCU School of
is a private university working under
Sir, you are on mute. Please unmute yourself. Sir, unmute yourself. You are not audible.
Okay. Am I audible, sir, now?
Yes, sir.
Okay. Very good afternoon to one and I welcome Professor Dr. Raju Wadekar, sir, for this particular seminar. And very much thanks to him just taking some his valuable time to deliver the seminar. So may I take the opportunity to introduce our PCU. Actually, sir, PCU School of Pharmacy is a private university working under the umbrella of Pimpri Chinchwad Education Trust. Pimpri Chinchwad Education Trust, that is PCT, is a trusted brand in education since 1990, offering quality education from KG to PhD. Actually, it has a legacy of nurturing excellence since its establishment in 1990, with a sole mission at serving society, the industry, and all stakeholders through value inculcating quality education in the area of schooling as well as professional tutelage in the field of engineering, management, and computer application. At PCT, we aim to ignite the spark of learning in each student. Our 11 institutes are spread across 3 campuses over Nigdi, Ravet, and Satemawad, which has carved out a name of themselves, having transformed the lives of over 4,600 students so far. Our institute, Pimpri Chinchwad College of Engineering, Pune Business School, and SB Patel College of Architecture and Design are some of the most sought after college in the country. With the inception of Pimpri Chinchwad University at the Satemawad, its milestone project, PCT has set its aim to high to transfer students into trailblazers of tomorrow. So set on a sprawling 10 acres campus in the bustling Pune metropolitan area, our university boasts state-of-the-art infrastructure to inspire and empower students and teachers. With some of the biggest brands from across the industry in the vicinity, that is General Motors, JCB, Infosys, and more, our students will have tremendous opportunity to connect with the business world and gain real world experience. With this brief introduction, I will like Professor Moirish sir to proceed with his speech. Yes.
Thank you, sir. Thank you, sir, for presenting a brief overview of Pimpri Chinchwad Education Trust and Pimpri Chinchwad University. It gives me immense pleasure to introduce Dr. Raju Wadekar, sir, Assistant Professor, Pharmacognosy and Phytochemistry at SVKM Institute of Pharmacy, Dhule. He holds a rich academic experience of 17 years. He earned his PhD from KLE University, Belgavi, M.Pharm, first class with distinction from KLE University, and B.Pharm, first class from North Maharashtra University. He has also completed professional diploma in clinical research. He has 23 publications to his credit in peer-reviewed journals of national and international repute. He has authored 8 books holds 4 patents to his credits, and has H-index of 9. He has fetched several research grants worth rupees 5 lakhs from Savitribai Phule Pune University. He has been nominated in Marquis Who's Who 2012. He was awarded Summer Research Fellowship by Indian Academy of Sciences, Bangalore at IHBT Palampur. He is a recipient of Young Scientist Award, Best Faculty Award, Best Research Paper Award, Employee of the Year Award, Best Research Project Award by Savitribai Phule Pune University for his research entitled Evaluation of Anti-Arthritic Activity of Yograj Google Formulation. He is a life member of APTI, ISTE, SPR, Indian Society of Pharmacognosy, Society of Pharmacognosy and Phytochemistry, to name a few. He is also an editorial board member and reviewer on various journals. So with this brief introduction, I welcome Dr. Raju Wadekar, sir, and over to you, sir. You can proceed for your session.
Thank you, sir. Am I audible?
Yes, sir, you are audible.
So very good afternoon to one and all. First and foremost, I wish you all a very happy Akshaya Tritiya to all the members of Pimpri-Chinchwad University. I'm very much thankful for Pimpri-Chinchwad University, honorable management, then all the respected faculty members, students for inviting me for this guest lecture, for this webinar. Now I would like to share my slide. Sir, can I share my slide? Because the sharing option or host disabled participants screen sharing.
Ma'am, please enable the sharing option. Sharon,
So
ma'am.
that I can share my slide.
Done, sir.
Yes, you can share, sir, now.
Yes, sir.
Yes.
So now is it visible?
Visible, sir. Yes.
Okay. Putting it on slideshow. Okay. So it is visible now?
Yes, sir.
Now, today's webinar is on the topic, the pharmacognosy is all about pharmacognosy, natural factory. For modern medicine, I intentionally have taken this word for natural factory. Of course, it is a biochemical factory which enables for the synthesis of n number of modern medicines. Dear students, already you are studying pharmacognosy, phytochemistry, one subject in this unit, semester 4, right? Students? Okay. Sir, am I audible? Because
Yes, sir, you're audible.
Okay. I'll move ahead now. Okay. So today's topic will be on mostly focus on the overall aspect of pharmacognosy as a natural factory for modern medicine. Disclaimer for this presentation is made for educational purpose only and not made for any commercial utilization. And interest on the information provided in this presentation by myself as a presenter is taken from my own personal experience of the subject and understanding and from the references quoted at the end of the presentation. So every course should have some learning outcomes. So after completion of this topic, after discussion on this topic, the student should or will be able to understand the perspective and perspectives of pharmacognosy. Then what is the role of pharmacognosy in drug discovery and drug development? Further, the commerce and regulation of herbal drug industry. Because students see, pharmacognosy, no doubt, is that it deals with the study of crude drugs. But once you study these crude drugs, ultimately our main aim to get these crude drugs into commercial world from where we can earn money. So it is simple, like from plant to penny. Because we all are here in pharmacy to earn money, to get jobs, to be a good entrepreneur. And with this knowledge, this skill and this technique, what we are going to pursue throughout your this 4 years of degree course, that will lead you to become a good entrepreneur, to become a good professional in our pharma industry, just to earn good money. So pharmacognosy in that it really helps a student after learning this concept that how we can utilize this knowledge of pharmacognosy and how we can convert it in, we convert these two drugs into a herbal drug and from herbal drug to herbal drug industry. Okay, so that is what we are going to study, and the student will able, and definitely I'm sure that after understanding this topic, student will really going to have this concept very much clear. So the content of this topic is the very first is pharmacognosy, the introduction. I will not go that much more detail into it, but yes, little bit we will have a introduction to pharmacognosy. Then we will see the perspective and prospective of pharmacognosy, because we should have some perspective towards that particular course, towards the content of the particular course, and then how we prosperous it, how the prosperity related to that subject is, that one need to understand. And once we understand that, then how it is helpful in the various drug discovery and drug development program. And then the commerce and regulation, because commerce is all about the trade, all about the money, all about the business, right? Of these crude drugs or herbal drug. And then we will have a summary or concluding remarks followed by references. So in introduction, dear students, as you know very well, in ancient only, see, I'll give a very good example that every morning we wake up and we take a very good cup of tea. Then you feel very fresh for at least 1 hour. Why? Because the tea leaves contains caffeine. So hence, before we were not knowing about that tea contains caffeine, and that is why we feel so fresh and we get that same stimulus activity. No, it is all about, it was there in the previous or say ancient days, where the use of these herbs were taking place. The knowledge was very much in crude form. So human civilization was depend on natural products for to survive to their day-to-day the desires. Say, for example, I will always say that a person has 3 basic needs: food, clothing, and shelter. But above and all, the very important is health. Already we studied this in COVID. So in COVID also we were having everything. But if you don't have a health, you will not get prosperity. Prosperity will not be there. So it means what? One, to have a proper medicine, a proper curative, preventive, therapeutic components from natural products, okay, to keep us healthy, okay, so that we can live our lives to the fullest. All right. So it is already there in the ancient times, use of natural products with therapeutic properties. It was known, but they were not scientifically proven at that time. So the knowledge from Vaidyas means from in India, from Vaidyas in China, they were having Chinese system of medicine. In we can say in Western world, they were having Western system of medicine. Arabs, they were having Avicenna or say Unani system of medicine, and so on and so forth, right? And but the evolution took place from region to region, from the era to era. Throughout history, people have collected wild plants and cultivated them near their homes with the intent of maintaining and restoring good health. Very good example is Vasaka. You know Vasaka? Vasaka is called as Ada Toda. Ada Toda means goat do not eat. And at that time, in ancient days, people used to cultivate or used to garden that plant that as a Adathoda Vasika plant as a fencing, for the purpose of fencing, because goat is not going to enter and it will be protected. At the same time, this Vasaka was having a very good anti-tussive, anti-curve property. So whenever any person in that home is not feeding or the suffering from cough, immediately they go and take that leaves of Vasaka, okay, and or Sadulsa leaf, they are taking, and then they are making juice out of it, fresh juice, what we call as swaras. And then it is mixed with like ginger swaras and then adding honey into it. So it is a very good blend. It's a simple sweet syrup at that time, you know. So this is how the evolution of pharmacognosy, the subject, has taken place from one generation to one era to another era, for fighting infectious disease, for having good healthy life, for regulatory fertility, and so on. Furthermore, when we went ahead, then the alliance between the plants and medicines and the spans history took place, and particularly in various civilization. And this medicine primarily took the form of fruit drug. Means initially it was no such fruit drug type of concept was not there. It was only plants. It is cultivated or say wild and so on. But their knowledge, their use was properly written. The books, the literature was collected, and this literature further evoked, then studied by various scientists, by various peoples like you and me, as a pharmacy or as a a dwellers. So, and then they found out the properties, the active constituent present into it, as there is development of technology and knowledge took place. So initially in 14th, 15th century, there was no such technology. But when in the 18th century, the technology took place of isolation, separation, many compounds came in existence. Molecules came in existence as a very good medicinal component. Eventually, this data concerning medicinal values of these plants was recorded in the herbal literature. So, in short, this all the legacy of converting a plant into a drug into a medicine, and then that medicine is then marketed further, okay, to get good job opportunities, to get commercialize it. So that is what our job is as a pharmacy. And in that, pharmacognosy play a very pivotal role. So I must suggest and I must request each and every student, please look at the pharmacognosy as a mother of all the science. From that pharmacognosy, the study of food drugs, standardization food drug, it really going to help for the development and discovery of medicines. About 25% of drugs prescribed worldwide come from plants. This is a complete fact about the plants. Plants means they are medicinal and aromatic plants, and more than 121 such active compound being in current use. For example, very good example is, anti-cancer molecule Vinca. Vinca means Sadafuli. Sadafuli मध्ये vincristin, vinblastin प्रकारचा एक alkaloid असतो. It has a very strong anti-cancer activity. So we can see how this drug, how this plant has evolved from the plant to the drug and to the medicine. And of course, of 252 drugs, I know the figures will increase nowadays. They might have increased. Yes, of course, because the research is still going on. And one thing I would like to tell here, students, please note down, pharmacy is not just a subject of learning, but it's a subject of research. Okay, so you have to keep on doing research. There is no end, but whatever you gained it, okay, you get it through that research outcomes, okay, that is going to beneficial to the society. So the 252 drugs considered as a very basic and essential, which is approved by WHO, whereas 11% are exclusively from plant origin, and significant number are synthetic drugs that also procured or that also produced from the natural precursor. Means what here? Natural precursor म्हणजे काय? What I want to say here is that, say for example, there is a plant called as willow tree. Willow tree, Salicix alba. The example already I have quoted here in next slide here. The slide is visible to you all, sir?
Sir, yes, it is visible, sir.
So, dear students, as I am quoting here the example, this is Salicix alba plant. So, this Salicix alba plant, willow tree, the bark of that tree contains salicin. This molecule, the medicinal chemist has extracted, isolated, purified this compound. But this becomes a precursor for the biosins. When the acetylation of this salicylate takes place, okay, then it becomes a precursor for the synthesis of acetyl salicylic acid, what we call it as a aspirin, which is one of the excellent drug as an anti-inflammatory compound. So acetyl salicylic acid derived from this natural product. So what I want to say here is this salicin become the precursor for the synthesis of aspirin or acetyl salicylic acid. So these all synthetic compounds also, they derive from the precursor of natural products, precursor of these plants itself, plant products. All right. Furthermore, pharmacognosy has been derived by the merger. See, friends, here, one thing I want to clear to all the students that in previous or in ancient days, from country to country, from world to world, the definition of medicine was different. In India, we were having Dravya Guna, we were having Ayurveda, we were having Siddha system. Okay, when you in Afghan it has some Unani and all like that. So these all peoples in Greek, it is the apothecary. Apothecary means the pharmacy. Okay, and every system of medicine, what we call it as Indian system of medicine, alternative system of medicine, or integrated system of medicine. All right. So the medicines were working or development of that medicine based upon their certain principles. So what we did is when the technology have driven, so what we did is all these brainy peoples, they came together and they said that somewhere we need to bring this system of medicine, this subject of medicine at one platform. So why not is it possible to convert all that knowledge into one form, that is English, so that every world around the world, this all knowledge will get percolated in the same direction, in the same uniform way. Then only the quality will maintain. How you will define quality? Quality means uniformness. So whenever if you have the subject uniformity, it means it is a quality subject. And therefore, the some of this Greek terminology, because the research on this pharmacology was much more in the Greek civilization, and from us, from our India, we are having more of Ayurveda. So they have taken some Ayurvedic concept to convert that Ayurvedic drugs into a modern drugs or modern medicines. Okay, with the help of this technology and the knowledge and the skills as well. So therefore, they have converted this whole subject of medicine into pharmacy. And then again in pharmacy, there is a formulation that goes to pharmaceutics, then goes the chemistry, then it goes to medicinal chemistry, then when it is an activity, property checking on animals and human subject, then it goes to pharmacology, and when it is from natural products, it comes to pharmacognosy. Understood? So therefore, this the subject was classified according to that nomenclature, because pharmacognosy is nothing but it is obtained from the two Greek words. Pharmakon means a drug and gignosko means knowledge of. So once we get or to acquire knowledge of a drug is nothing but the pharmacognosy. Okay, so what type of knowledge? Then the knowledge is in with respect to, or knowledge, the study in respect to the physical, chemical, biochemical, biological properties of the drug substance, potential of drugs. So all this knowledge, all this study encompasses the subject called as pharmacognosy. Dear students, teachers, please let me know if I am going very fast, if I am discussing very fast. Hello? Okay.
No,
So, because
yes.
this subject, I'm very much fond of this subject as my special subject. So when I start, I get completely involved into it, right? So this is how one need to have this perspective toward the subject for learning of the subject, friends. So after that, yes, because any subject never starts with one point. There is no emergence of only one set point, but it is a composition of so many system of medicine together, as I already discussed. So very first of all, it was from India, because in India we were practicing Ayurvedic writings, Ayurvedic system of medicine with the various great persons and personas, scientists like Charak, Sushruta, Astanga, and so on. And they have written so many books onto it, how to formulate the drug, what will the pathophysiology, and so on. Okay, so the knowledge of this ancient India, ancient system of medicine is also equally important to contribute in the field of pharmacognosy. Similarly, in China, there was a king, Shen Yu. Okay, he have written so a book called as Penti So. Okay, where for the 1 year he has collected, for every day he used to collect one drug and then used to study that drug completely, and then it has started written in the books. So as you can see, this is a one example of drug called as hemp, cannabis. Okay, so it is mentioned in that book called as Chinese medicinal plants from the Penteso Kangmu. Okay, so means, and why it is happening? So why it is so important? It was written in 2700 BC. So whenever the next generation will come, they will take reference of these books and then they will start doing the research on that plant. They will explore that plant from the very different type angles, and therefore they can bring discovery and development of that plant in the coming future as a potent medicine. The history of natural products in medicines, as I just listed here, friends. So it is not just today or tomorrow's Sichuan medicine. It is not like that. It was way back from the 3rd millennium. Then in Egyptian civilization, Hippocrates, Dioscorea, every civilization have played vital role in the discovery of this subject, of the study of crude drugs. Okay, they are used as a traditional healers, as we can say. And yes, they have mentioned that all plants in the books, in the literature. All right. And then from the 16th, 17th century onwards, the scientists, when there was technology has driven take place, the peoples have started working on these plants and started exploring the pharmacognosy much more in detail. Okay, and then it came pharmacognosy and phytochemistry subject. Initially, it was only pharmacognosy that deals with the study of the drug. But one technology took place, okay, came then the technology in terms of extraction, isolation, purification. Okay. So at that time, the phytochemistry also get added into this subject. That we will see next in the next slide. So as we are approaching towards the 18th century, so again with the knowledge of this, some great persons like C.S. Adler, a medicinal student in Germany in 1815, he written a subject or the thesis called as Analecta Pharmacognostica, where he have mentioned again so many nomenclature, synonyms and plant detailing into it. Furthermore, this research has found in the earlier usage, and the physician J.A. Skimit from Vienna used that one in this Laboratory der Medica, Materia Medica, means the medicinal material, in 1811 to describe the study of medicinal plants and its property. And so on, friends, many scientists, they started working on these plants by taking the previous references. Okay, of course, from the traditional plants, even the peoples at that time, they were travelers from one country to another, and then they exploring that. Darwin, as an example, he had traveled all over the world, and then he has explored the zoo pharmacognosy, explored the plant pharmacognosy, and so on. Now, the second point comes that in introduction part, we already studied now what is pharmacognosy, how the pharmacognosy has evolved from the previous centuries up to 18th century. Now, the perspective towards the pharmacognosy with respect to its perspective has been started changing, or it has started changing. Okay, yes, because of again the technology, knowledge, and skills that what we are taking. So that's why I've kept here this machine. The engineering also helps us to develop various certain technology. So in 1811, as the book was published, which was a work on medicinal plants and their properties, further Linnaeus has started working in classifying the plants. And at the end of 18th century, crude drugs were still being used as powders, simple extract, or tincture. Why? Because that medicinal properties were already mentioned in the books which were written in 1811. Okay, and further, as I told you, once the technology started developing 1803, further the isolation of some compounds from opium, the morphine has been isolated, then strychnine, then in 1820 quinine, further in 1828 nicotine, 1833 atropine. So the discovery means, for example, the students, those who are be under the umbrella or under the learning aspects of the teachers. Okay, जो भी teachers थे उनके under जो भी students थे, they were working together in this subject of pharmacognosy. So that teacher might have isolated, let's say, strychnine in 1870. So by taking the same references, next student might have extracted quinine and caffeine. Then further, nicotine was extracted by some other student. So now we are having so many pharmacy colleges, right? So the students at in or other colleges, they are doing so much of research, right? So somebody is publishing, somebody is reporting from plants, right? So the same way, this discovery, the perspective and prospective of pharmacognosy started from 18th century. Okay, and no doubt some plants are or the studied as per the serendipity. Serendipity means discovery by chance. But yes, for example, there was a king lived in Peru, Sincon region, okay, in Europe. So one fine day, the queen was not feeling well. She was suffering from chills and fever. So all the kingmates all they were worried about it. So somebody told to king that that some plant bark is there in that forest of Peru Sincon region. Somebody should go and get it and just give the decoction of that cinchona plant or the bark to the queen. So she will get cured. So immediately they went and they brought it and they gave it to her, and she get cured. Okay, so all that stories were also written or they are brought from mouth to mouth publicity, and somewhere in 19th or 18th century onwards, on in mid of 18th and 19th century, Kenneton and Palliator, these were two scientists. Okay, they explored that story of cinchona plant. That they said that's really it work. Then they went in that particular forest, they collected the plant, they studied, they did isolation extraction, and they brought the molecule like quinine from that cinchona plant, because the plant name was given from that region, from where it is obtained, from where it is collected, right? And then that quinine become one of the miraculous drug for as an anti-malarial, right? So the discovery takes place very in a step-by-step manner. It requires a lot of patience, lot of study, lot of involvement of the subject. Yes, now we are moving ahead in 19th century. In 19th century, the chemical structure of many acid compounds were determined, like alkaloidal drugs, glycosidal drugs. You already studied the classification of drugs in semester 4. Further in 20th century, the discovery of important drugs from animal kingdom, particularly hormones and vitamins, were also extracted, isolated, studied and identified. Nevertheless, microorganisms have become very important source of drug as well. No doubt, they were there in the 18th century, like penicillin and all, but then they are more in pure form, more in executive form, they are used at that time. Okay. So this is just example. I would like to quote here the perspectives and how they are prospectively grown in the pharmacognosy. So it was in 1870, again it's the mid of 18th and 19th century, as I told you, the crude morphine derived latex of poppy of Papaver somniferum. Friends, these biological source, then family, these are the some taxonomical nomenclature was also growing at the same time when the subject of pharmacognosy is growing. So botanical, zoology, these all subjects are growing parallelly, right? Say somebody when they are working on opium, so the taxonomist or say botanist, pharmacy used to take it to the botany. Please identify this plant. How you identify? Then they start studying on it. It's taxonomical data. So they started its kingdom, phyla, subphyla, and then class, subclass, then family, and like that. So it was taxonomically derived, and then its family was also decided. Further, this plant, opium, that is Papaver somniferum, was boiled in acetyl anhydride to yield diacetyl morphine and found to be readily converted to codeine. That is a very potent antitussive molecule. This is a very good antitussive molecule. Okay, but it should be given against prescription of medical practitioner only, because it is addictive in nature. That is why means when the discovery of drugs took place via pharmacognosy subject, then it was also brought to an attention, okay, that some drugs are very much addictive. So for that purpose, some laws were formed or constituted just to have control on their sale and procurement. So there is a law called as Drugs and the law called as Narcotic and Psychotropic Substance Act 1985. Yes. Okay, so under that, these drugs should not be procured. It should be there, but the government should have all the rights for it. Okay. Further, yes, this is drug what we already discussed with you, the anti-malarial drug quinine, approved by the United States. So you can imagine, friends, as I can go in the last. So it was in 18th century. Actually, these drugs, it was in the stories of that king and queen. But due to Palliator and Caventon, they have discovered this molecule quinine from this plant. Okay, and then this molecule got recognition, approval by US FDA as a potent phytoconstituent or as a medicinal drug. So what is our topic? Natural factory for modern medicine. So isn't it? Yeah, okay, you can assure, means we are in a connection with this only, with our subject, with our topic, that really pharmacognosy is the natural factory. For what? For this modern medicine, okay, which was approved by US FDA as a potent anti-malarial. Now we have tablet, capsules, and all those things. Okay, has been used for centuries for malaria, fever, injection, mouth and throat diseases, and indigestion, mouth and throat diseases, and cancer as well. Okay, recent example in COVID situation, America have imported so much, many quantity of this, so much of quantity of cinchona plant, because somewhere it was found that this cinchona plant or the quinine plant drug from this plant, okay, this quinine molecule, that medicine also helps in cure of COVID. So it was, and it was only cultivated in India itself at larger scale. So we have exported to American dollars came in our country. So it means what, friends? Pharmacognosy, it's not just a factory of modern medicine, but it also helps to the nation to grow economically. So for the economic development of the nation, the study of medicinal plants and that derived medicines are very equally important. And that is why this subject has incorporated in your syllabus. And I request each and every student, please look this subject from a commercial point of view rather than just a subject or just a course to complete. Understood? Now, the third point, that how this drug discovery and drug development happened with this pharmacognosy subject. Now, friends, when we are linking with our topic from the introduction and then second part, that is perspective and prospective, then people started in 20th century, why not to have a research or why not to discover medicines out of it? Because we cannot simply give the powders and extracts to the patient, not possible. So if I want to convert a pure medicine, okay, into a proper pharmaceutical dosage form, it may be a tablet, capsules, or parenteral, it has to be in its pure form. And for that, one need to go for drug discovery and drug development. So the discovery development are interrelated, interdependent with each other. Okay, so when the crude drug is studied with respect to its complete physical, chemical, physicochemical, phytochemical study, then it undergoes drug discovery. It means the molecules are isolated, purified, standardized. Okay, and then that molecules are studied for pharmacological activity, and then that molecules are converted into a proper drug. It means the drug is developed, okay, in a suitable form with the help of pharmaceutical operations, unit operations, you know. So in pharmaceutics that the people do, but for that they should have the medicine, and that will only going to bring, or that is only going to have from pharmacognosy subject, the theory, the practicals, right? The approach, the skills, the techniques. So herbs can be turned into a product now, and pharmacognosis is playing active role in the discovery, characterization, production, and standardization of natural products. It means what, friends? Please pay your attention, very important. It means you have so much job opportunities. You have job opportunities in natural product discovery, you after PG, PhD, and further study which is going on. These all things are going on. These all processes are going on in industries at larger scale. A number of MNCs that I will enlist that all things in the last topic, commercial, that fourth topic. Okay, that how discovery, how characterization, how production of these herbs and herb-derived medicines have so much of impact on our job. Yes, they do have very positive impact. So we have a lot of opportunities to work with this subject. However, last 200 years witnessed a substantial metamorphosis. Metamorphosis means what, friends? That how from that worm converts into a beautiful butterfly. So that is called a metamorphosis. So this subject of pharmacognosy has undergone a lot of metamorphosis, friends, and it's still going with coming with the very good and novel compounds for the treatment, for the cure, for the prevention of very dreadful diseases like like cancer or like diabetes or HIV and so on. Okay, and all that medicines are really going to have definitely from this plant source. In addition, pharmacognosy studies of variety of commercial and medicinal products such as vitamins. Means I'm not only focusing here in major medicines, but a minor but still essential. I will say here the essential. So from plants, we do get vitamins, we do get enzymes, we do get pesticides, we do get some allergens, which helps to test the allergenic reactions in the patient. So that also we get from this pharmacognosy subject, studies of pharmacognosy of a crude drug, right? And that becomes commercial. Nowadays, you can see Mama's Earth products are there. Simple, everybody is knowing that onion oil is available. Mama's Earth onion oil for hair loss. Okay, for prevention of hair loss. Okay, let me clear. It is a prevention of hair loss. Okay, or retaining the hairs which are already there. So, have you ever thought of that? There is a onion oil will come in market. This onion, which is our day-to-day food stuff. So what is that onion oil contains which has this type of property? So this all comes that even your cosmetics, okay, the major cosmetics, okay, so that we have huge market on it. So friends, we need to think from that perspective. We need to broad up we need to think from 360-degree towards this subject, and thereby we can get very good products out of it. And nowadays we have startups. There's so many startups are there. Universities are working hard to get the students involved in startups, to get their get them more good entrepreneurship development, and so on, friends. There are a lot of opportunities. Further, the research problems in pharmacognosy include studies in the area of phytochemistry, again, that is drug discovery, drug development, microbial chemistry, that again is a part of pharmacognosy, because pharmacognosy means everything which we get from nature. It may be a soil, it may be a water, it may be a marine, it may be anything, okay, which is natural. And the study of this, that becomes from the plant point of view, it becomes phytochemistry. If it is micro, then microbial chemistry. The biosynthesis, biotransformation, chemotaxonomy, and other biological chemical sciences are also a integral part of the subject of pharmacognosy and phytochemistry. Understood? Clinical pharmacognosy, analytical pharmacognosy, and industrial pharmacognosy. So they go hand in hand, and the stepwise they grow, okay, in their own subject, in their own field, and have been established as a specified and professional offshoots of pharmacognosy. Offshoots means they are the integral part to meet the contemporary advancement in the field of pharmacognosy. Means what are the problems are associated with any problem? Say, for example, if I want to develop a medicine for as a blood purifier or blood enhancer, then I will always search for herbal plants. I will always go for the medicinal plants. Why? Because they are very safe and they are very much proven remedies, right? So just I have to study them from pharmacognosy, phytochemistry aspect, and bring them, and and I need to prove their efficacy, safety, okay, and then that I can convert it into a proper medicine. That is why pharmacognosy is a factory of medicine. Even we can explore this marine pharmacognosy. There are so many marine organisms, flora and fauna, that still is explored. There are National Institute of Oceanography, Goa. There also, even in India, we have 4 centers in NIO, which are beside the ocean and seashore, so that they can get all that algae or bacteria and everything from them, crabs and all, and from that even you might have heard about shark liver oil. It's very much rich in vitamin, right? So this is how we can make medicines out of this marine source also. analytical pharmacognosy, which mainly refers to the standardization of drugs, because simply having medicine out of the crude drug, that is not going to fulfill our need, but at the same time, it has to be standardized from all aspects. And then herbal formulations, preparation of herbal formulation, nutraceutical, cosmeceuticals, and so on. Okay, so we can use this subject of pharmacology to convert from a crude drug, from a plant to a medicine, and from that medicine to a new and novel system of medicine that we can approach. I will show the example here. Then further, molecular pharmacognosy, genomic pharmacognosy, and metabolic pharmacognosy. That is also a important integral part of the field of pharmacognosy, where it deemed has been promising approach of pharmacognosy research to accommodate future demand in molecular biology. It means what? How this molecule, for example, tomato contains lycopene. In India, if the tomato price goes down, that farmers simply give, shed off all that tomatoes on roads and all. It's better, we'll tell him, please give it to us. We'll extract lycopene out of it. And that lycopene, how it works at various molecular site as an antioxidant, okay, or as an anti-cancer in body, in patient's body, in vitro, in vivo. And that molecular biology will help to understand the mechanism of action of that lycopene, which is obtained from the plant. Understood? From the very simple fruit like tomato, which is a very great antioxidant. It is there in market. Okay. Even the biotechnology, pharmaceutical plant biotechnology, analytical chemistry of natural medicine, plus medicinal plants, they all attribute. Means all these component, all these disciplines, pharmacognosy disciplines are there. They are the multidisciplines of pharmacognosy and phytochemistry, like molecular pharmacognosy, marine pharmacognosy, metabolic pharmacognosy, that are working for the same aim and same vision, that is to develop a potent, safe, effective medicine for the treatment, cure, and or to provide a service for the healthcare. Understood? And that only we can do. That only we as a pharmacy, because the doctors cannot do. Doctor, they only know from the tip of hair to the nail of toe, HAP, pathology, but they don't know which medicine, how it works in the body and how it has to be developed and discovered. No, that we are there. We are giving them medicines to a doctor, and then doctor prescribes to the patients, and this is how the same biotic relations takes place with doctor, patients, and pharmacists together, and for the main aim, with the same goal, to have a good healthcare system. Because if any country's healthcare system is not good, definitely that country is going to be underdeveloped for the centuries together. So the health hygiene of a country is one of the leading cause for the development of that country. Because what happens, no friends, if any country is suffering from many diseases like or disorders like diabetes, so lot of economic burden for that family take place. If in my family, if somebody suffering from diabetes, then that medicines kharcha and all that, every month ka jo kharcha hota hai itna ki even BP patient or say diabetic or say cancer patient, then I have lost all my savings. Ultimately, I cannot contribute to my nations for its growth. Right? And that is why it is important, warranted to work with this field of pharmacy, okay, to get good and novel medicines, so that we can cure, we can prevent, we can treat patients on time, that disease on time, we rid of already. Even in TB, TB is very dreadful disease, friends. Still, we don't have complete cure for it, right? So as I'm talking about the standardization, yes, of course, all herbal drugs, all plants which are discovered and developed through pharmacognosy, they need to undergo lot of herbal drug standardization procedures, such as or parameters, such as pharmacognostic study, phytochemical study, physicochemical study, and residual analysis. These are these are approved by WHO. WHO has already approved these parameters, these some sets of parameters. It means what you are doing in laboratory, like taking transfer section, doing chemical tests, that will help you to develop your own research or your own analytical lab. Yes or no? So simple. See, friends, in laboratory, whatever you are doing, that is a leading cause, or that will lead to you for your entrepreneurship development. Say, for example, if I know how to standardize the herbal drugs, and for that I require only one single lab where I will need some chemicals, I will need some instrument. So after BPharm, can I have my own analytical lab setup? Yes, I can provide that service to this pharma industry or to this all research industries, right? So you will be the owner, and under you, all the students will work together. It is why it is possible, because you are getting knowledge of herbal drug standardization. You know what drug has to be standardized in what way, in what parameters. Okay, only you have to do the marketing that yes, give us the samples, we will get it done, all the standardization, right? Precisely, accurately, validated. Understood? So, whatever practicals you are performing in your regular schedule, friends, that all practicals are very much important from the drug standardization. Same practicals, same procedures are carried out in industries as well. So, you need to get skilled in doing this test. Okay. So, dear friends, as I keep on talking like Pharmacognosy Natural Factory, yes, this is my PhD work. What I have done, I have chosen all these three plants, Xanthosal marmatum, Trichosanthus lobata, Uvarian arum plant, on which I have subjected them for various pharmacognostic study. Then I took this plant extract with the help of again sophisticated instrument like Soxet apparatus, and then that extract is subjected for phytochemical study for separation, isolation of the quercetin compound flavonoid, which was further standardized with the help of UV spectroscopy, IR, where I identified my compound, and the same extract was studied for hepatoprotective activity in animal, where I found the plant extract has given significantly good activity, exhibited significant activity, and it helps in the liver cell regeneration. It reduces the elevated enzyme levels in the hepatotoxic animal. Okay, thereby it has very good with the help of antioxidant mechanism of this molecule. Means here I have undergone lot of drug discovery and drug development program of that plant, and then I can report it with so many papers out of it and publish papers. I did patent on them also, on the procedures and the product out of it, and this is how I am getting the benefit of it in my career, in my profession. Understood? Am I audible, sir? Is the screen visible?
Yes, sir. Yes, sir.
Because in between I need to check.
Yes,
It
audible.
is like simply I'm talking with myself.
No, sir. No.
Okay. So it is going well?
Yes, sir. Very well.
Okay. So this is how, dear student, this is the third point, drug discovery, or how we can develop a medicine out of these plants or from the subject. So when I did my master's in pharmacognosy, even I studied pharmacognosy in B.Pharm level very nicely, properly. I opted my M.Pharm in pharmacognosy from KLE College of Pharmacy, where I did this project on hepatoprotective activity. The same skills, same knowledge, same techniques helped me to pursue my PhD work, and I came up with this understanding of these molecules, understanding of developing these medicines or these products from the plant and this activity. Okay. Now, whenever we study any subject, friends, you should always ask question to teachers that, sir, ये सीख के मुझे क्या मिलने वाला है? What I'm going to get? मुझे उससे क्या फायदा होगा? Definitely पूछना ही चाहिए, क्योंकि कोई सब्जेक्ट का जब तक इम्पोर्टेंस, उसका कुछ कमर्शियल सिग्निफिकेंस ना हो, तो हमें वही मतलब ही नहीं उस सब्जेक्ट पर. तो वैसे ही फार्माकोग्नोसी पढ़ के मतलब है क्या? हाँ है. क्यों? क्योंकि फार्माकोग्नोसी एक तो फैक्टर ही है मेडिसिन की. फिर वो मेडिसिन मार्केट में है क्या, अवेलेबल होते हैं क्या, whether they are really in the market, they are really doing good in market or not, that also one need to think on, one need to study, right? And yes, friends, I am assure you, I am very much confident, the commerce, the trade, okay, the commercialization, the global market, the import market, export market, potential of these medicinal plants in all form. It may be in herbal pharmaceuticals, it may be a plant itself, like a plant, crude plant itself, powder, leaves powder, or whole plant or extract, they are doing excellent well. As we can see here, this is a source which I have taken, polarized marketers search, where they estimated that global herbal medicine market by form from 2015 to 2026. Okay, it is always going to be at higher side, as you can see here. It means you have chose a very perfect profession. पैसा ही पैसा कमाने वाले हो आप, है ना? So when you work in that industry from that perspective, okay, I'm always using see perseverance, okay, consistency, patience is really important key ingredients in getting this in pharma industry and developing pharma industry, friends. Okay, so in 2015, the tablet, capsule, powders, extract derived from the herbal plants was very much less than but the drug discovery, drug development took place. The factory increases, the multinational companies coming together, then they have very good expansion. We are now here in 2024, you can see the growth is good, and in coming 2025, 2020 definitely is going to increase, and definitely it is attracts this type of graphs, really attracts the people's or the what you say contributors, investors to take share of that particular herbal medicines, herbal companies, and therefore we can grow and we can work with them very properly, right? The next slide is all about herbal supplements and market size of the product from 2040 to 2025. Coming next year up to, also you can see here, moringa plant, शेवगाची शेंग, echinacea, flaxseed, okay, जवसचे seeds, right? Turmeric, आपले हळद, ginger, ginseng, बघा इथे त्याचं the increasing, the exponential growth can see here, friends. Okay, of all these herbs. So initially we have taken example of herbal pharmaceuticals in tablet form, capsule form, syrup form. Here the whole drug itself. Okay, maybe in powder form, maybe in entire form, maybe the leaves, maybe the roots, bars, fruits, any part of that plant in powder form, in tablet form, they are increasing as a raw material supplement. Okay, industry. Then the third one that I'm talking about, cosmeceuticals, that skin care products, again from 2014 to 2025, it has increased, okay, up to $128.16 billion, up to 130. So in 2015, it was same, almost same. Okay, and then as we can see, the growth rate exponential. There is no less growth. ऐसा नहीं कि यहाँ पर 2040 में इधर आया तो suddenly it has gone down. It is not like that. No doubt, some skincare will might have increased here. Somewhere the personal hygiene might have increased here, but here decreased. It may happen, but still it is stagnant. It is continuous, right? So yes, in cosmetics also, herbal medicines are working like anything. Okay, miraculous drugs, skincare, hair care, fragrance, even your perfume products, which we get from the plants itself, right? So it has huge market. Yes. Now, why I have taken this example, friends, it's very important to know that how these herbs, now as these are all Indian medicine plants, means study of pharmacognosy. Even the cotton is our, as already you have studied primary and secondary metabolites, right? Okay, in unit 4 and 5, you might have studied this. There the natural plant fibers you studied, cotton. Even you have studied this plant primary, secondary metabolite. Now what they did is simply they took the extract of all these haldi and clove and neem and all these things. They purified that extract, okay, and then they mixed with this cotton fiber. This is called as electrospinning nanofiber machine, wherein the mixture of cotton and the medicine, okay, is mixed together, and at the specific rate, okay, the speed and rate it was injected, okay. Sorry. Okay. Excuse me, please. So when this mixture of both the fiber and your medicines, herbal medicines are coming and fetching, just putting it, coming it on the collector sheet, there is a electric current, okay, applied on it, and that electric current induces the fusion of this fiber, that medicament into the fiber, and thereby it forms a very thin film. So this is a novel drug delivery. Again, it is a sort of medicine or medicinal products. Okay. And then this fiber, thin film nanofiber, which is a mixture of herbal plants or herbal medicine and your cotton as a polymer or say as a nanofiber, it is incorporated on this mask. One layer of that mask. Okay, one layer, second layer, like that. And when you wear that mask, definitely it will have shielding effect. So the outer layer, middle layer, inner. So inner layer. So the viruses will not able to enter into this inner layer because this inner layer is totally protected by this man, which contain medicine. Or though these viruses coming, they get killed because all these medicaments, these all herbal drugs contains antiviral property, and thereby the patient will get protected, prevented from the viral infection. Understood? Is that clear? It means what? This is how the from study of pharmacognosy, not only a factor of medicine, but also it gives a way forward for development of various types of medicines or say various type of dosage forms, novel drug delivery forms also. Okay. Right? You'll get phytosomes, neosomes, nanosomes, especially in the case where the resistance develops, especially in the case where the potent drug have or the synthetic drug has lot of side effects. So in that case, we can opt for this herbal drugs. Now, last but not the least, friends, concluding remarks. Yes, what we studied here is pharmacognosy evolved from this early use of natural products in medicine. Is systematically evolved from one era to another. It is estimated that 60% of anti-tumor drugs and anti-infectious drugs already on the market or under clinical trial are from natural origin. It is because of the study of pharmacognosy and phytochemistry. The vast majority of these cannot yet be synthesized. Means what I want to say here is that we cannot synthesize anti-malarial, antibacterial, or say some anti-cancer drugs in laboratory. And therefore, today also, we need to have these herbal plants, which is the actual source of these medicines. And these synthesized compounds are not economic also. Even they are not economical. For example, Taxol. Many scientists, Taxol is obtained from the Taxus baccata, which is an anti-cancer molecule. Many scientists, many research laboratories are under the verge of doing so much of synthetic reactions so that they can come up with the synthetic molecule of that Taxol, looking alike of that Taxol, having the same activity, but still they are failing. And therefore, they still today, they need the Taxus baccata plant. It has to be cultivated, collected, means or everywhere it is required, and then from that Taxol is isolated and still it is cultivated, collected, and therefore the market is huge. Study of pharmacognosy is a natural factory, is a natural factory for lead compounds, allowing the design and rational planning. So how this natural medicines, factor of natural medicine helps us? It helps us to design and rational planning of new drugs, drug delivery, biomimetic synthesis, means we can use some for one molecule I can have, just for example, वसा में vaccine होता है, the same molecule bromohexine is there. So once you know the molecule structure, we can develop same structure in laboratory, but it is very exceptional cases. But really it helps development and discovery of new therapeutic properties, not yet attributed to known compounds. This interest in drugs of plant origin is due to the conventional medicine can be inefficient. अभी ये क्यों जरूरी है pharmacognosy क्यों? Why we are lacking? Because what happens many of time the synthetic molecules, they do have lot of side effects, lot of toxic metabolites in our body. Okay, so therefore there is always urge to look for the natural option as a medicine, because natural products are always safe, always harmless, and therefore natural medicines are mostly used for as a medicine. Okay, because there are a number of problems associated with these synthetic drugs, such as side effects, other problems, metabolite forming, not having compatibility, bitterness, or other components, or say, or multi-organ dysfunction. They lead to various drug-drug interaction, drug interaction. They might not be compatible with the pediatric or to the geriatric patients, and so on. Even in pregnancy, they are contraindicated. So in such type of limitations, one can overcome that with the help of natural option only, that is pharmacognosy. And folk medicine and ecological awareness suggests that natural products are always harmless. So, but yes, no doubt we need to develop the perspective of research, drug discovery, drug development, and standardization of all these molecule obtained from this pharmacognosy and phytochemistry subject. References, these are the few references which I have quoted here, which I have studied. From that, I have brought this subject before you. And yes, this subject of pharmacognosy really helped me to develop myself in terms of research and some publications. As Raut sir said, the best project award under the able guidance of respected Dr. S.R. Naik sir. I did this project, evaluation of anti-allergic and anti-anaphylaxis activity. And we published this paper in a very renowned journal of Brazilian Journal of Pharmacognosy. Even we have evaluation of anti-activity drug, where we have got best project award. I did my PhD under the again able guidance of respected Kalpana Patil madam for the hepatoprotective of urinarum. As I told you, the 3 plants which have selected, urinarum, tricholanthus lobata. Okay, I did the complete phytopharmacognostic study, and all these papers were properly, means all the research was done properly. They are published in the public domain with good journals. Okay, and recent my publication is on anti-cancer molecule, that is nanovesicle based drug targeting to control tumor growth and metastasis. It is just published in the last year of 2023 in the journal called as Cancer Biology Metastasis elsewhere. So we need to strive hard, dear students. And of course, dear students, you have got excellent faculty members with you. You have very great faculty members with you. I know personally Raut sir, I know personally Patil sir. They have done enormous work throughout their the research as well as throughout the academics. Because we together joined the same institute, we worked together for last 11 years. And even we have published books also for students. As we can see here, Professor Raut sir and my name. He has really helped me out for writing this natural product chemistry. I'm really thankful to Professor Mayuresh Raut sir for giving me this opportunity. He is excellent person, excellent researcher, and he was a 25th is the highest cited paper in elsewhere of his own research work. So really hats off to all the faculty members, and they keep on strive hard in organizing such type of activities of webinars and seminars for having proper discussion. Friends, don't take it as a study material. Think from a discussion point of view. Discuss the things, get the knowledge, interpret the knowledge, okay, and get more and more. And if you get much more about it, please tell us also. Okay, we will also more than happy for you to get these things, right? So with this, I think I have any question and answers.
Right.
Sir, the session is open for question and answer
Yeah.
round.
The session is open for question answer.
In general, question can ask. Student can.
So we will take 1 or 2 questions as we are having another webinar lined up. So
Yes, yes.
due to time constraint,
Yes, yes.
whatever questions are there, I will post it to you. You can revert it back. Okay.
Okay, sir. Here only, sir.
Yes. So now I request all the participants to switch on their cameras so that we can have a group photograph.
Sir, just a minute. I think.
Cameras. Please turn on your cameras so that we can have a group photograph. Yes, everyone, be fast. Okay. One more. Yes. Done.
Okay. So I think there are some questions, sir.
Actually, sir, we are having a second webinar
Okay,
lined up.
okay.
So we will
But
skip
only
the
one
question
thing, sir.
answer session.
My
I will post you the questions which the students have asked in the chat box. Okay.
Okay.
Yeah.
So it is there. What parameters should be followed for the research in nutraceuticals?
So I would like to thank you, Dr. Raju Wadekar, sir, for your valuable guidance and enlightening our students with your vast knowledge in pharmacognosy subject. I would also like to place on record my thanks to Dr. Girish Desai, sir, Executive Director, Pimpri Chinchwad Educational Trust, Dr. Manimala Puri, Vice Chancellor, Pimpri Chinchwad University, Dr. Sudeep Thepre, sir, Pro Vice Chancellor, Pimpri Chinchwad University, Dr. Rajesh Patil, HOD School of Pharmacy, faculty members, marketing and technical team of PCU for their valuable cooperation and support. Last but not the least, I would like to thank my dear students for your valuable presence. So with this, I conclude today's webinar. Thank you.
Thank you, sir.
Yes, thank you, sir.
I'll
We
leave, sir.
will talk.
Yes.
Okay, sir.